Hey, everybody, I'm here today with a really great podcast guest, Dr. Napatia Gettings, who's a leading expert in child adolescence and young adult brain health and development trained by celebrity Dr. Daniel Amen. And of course, she's a Lyme literate specialist, which is why I'm so excited to have you on, Dr. Gettings. So welcome to our podcast.
Thank you. Thank you so much for having me. I'm excited to be here and have some really good discussion.
And I'm back today with a special guest co-host, Michelle McKeon, who has been a recurring co-host with me with many other doctors. And I'm really excited to learn from the questioning of Michelle and all the answers you're going to give us today, Dr. Gettings. So Michelle, welcome back.
Nice to be here. Hi, everyone.
So Dr. Gettings, can you start by just walking us through a little bit about your background and who you are and how you ended up in the world of being a Lyme literate medical doctor?
Sure. So I am a double board certified child, adolescent, and adult psychiatrist. And essentially what that means is after college, I went to medical school and decided to pursue training in the specialty of psychiatry. And within that specialty, there are 5 separate areas of concentration, if you so choose to focus on, one of which is child and adolescent. And so I completed a child and adolescent fellowship at the University of Illinois Chicago Juvenile Research Center. I really had no intention on being a Lyme literate doctor. I didn't even know there was such a thing, okay? And so being a psychiatrist and working with kids, I work with a lot of children with neurodevelopmental diagnoses, and they really require a lot of understanding of how the brain develops, and a lot of protection is what I have found in my career from the adverse effects of medications and misdiagnoses. So after being in private practice for almost 10 years in the Chicagoland area, I decided to move to South Florida. And Dr. Amen at that time was opening up the Hollywood location. We now have 10 clinics nationwide, and this was in 2022. The way that the entire family, I call it my family, is structured is you really have the integration that is needed. Kind of what I see as a pitfall with the way that we operate in medicine right now is the pendulum kind of swung to a lot of specialties. So anytime a person goes to the doctor, everything is really split up. We've kind of lost that integration. And so what I found meeting with Dr. Amen, who's been one of the most amazing mentors I've ever had, was hearing about his journey with just kind of stepping away from this standard symptom cluster approach to diagnoses. And so it was very unfamiliar for me because that's not how we're trained. And I just dove right in. Ever since 2022, I have scanned, I want to say, close to 1,000 brains. Had an opportunity to have a mental wellness retreat on the Real Housewives of Atlanta, working with our Atlanta crew. So it's just been very fast paced, a lot of knowledge, and our functional docs have really, really helped me understand how important it is to screen for underlying diagnoses that lead to psychiatric or neuropsychiatric symptoms, which I don't believe that we're doing well enough right now, just as a medical community.
Yeah, I mean, I feel like what really sets you guys apart is that you are scanning the brain and trying to figure out, what's misfiring or is there enough blood flow and things like that. And it's interesting because people will get hurt, and if someone like breaks their ankle or tears a ligament, you do a scan for that, and then there's therapy to get better. But when you go to many psychiatrists, it's kind of like, okay, let's listen to your symptoms and come up with a treatment plan. However, oftentimes the brain is very complex. So I know that through Dr. Amen's training, he does a lot with brain specs. And for our listeners who are not familiar with brain specs, can you explain what that is, how you use it in practice, and how that might be different or beneficial in some ways rather than using a CAT scan or an MRI, like how that changes the diagnosis and treatments?
Sure. So Dr. Amen essentially pioneered a functional approach to psychiatric evaluations. And at the root of that functional assessment is SPECT. So SPECT is an imaging tool that is used in hospitals, outpatient clinics. It's not a scan that is not known to the medical field. It actually ends in CT because it's a type of CT. However, most people who hear about a CT scan or who have had one themselves, they know that it is a structural scan. So that is the difference. If you go to the ER because you've had a car accident, you have a concussion, they say, okay, well, we're going to give you a brain scan and let's see how you're looking. Well, a lot of times people are told, well, everything's fine, but we think you probably have a concussion, and then you'll get a concussion protocol with all of the precautions and you'll be sent home. The problem is CT scans that are structural scans, they're designed to screen for just that, structural abnormalities. They're not designed to screen for activity abnormalities. So if I'm injured in some type of an accident and I'm bleeding internally, or I have fractured my skull, I need to see a neurosurgeon, I need to get to the OR. That's really what that head CT is for, to ensure that you don't have someone with a epidural hematoma who needs to be operated on immediately. And so what happens is we miss a lot of people who've had even mild head injuries that have injury that needs to be addressed. And we tell them that they're okay because there was no structural damage. So essentially what SPECT does is it uses a IV tracer, similar to how with a structural CT, you get IV contrast, and you're able to look at the blood flow and activity in the brain. And it is a tool that's used to not only evaluate the brain, but also other organs like the heart. So I feel like sometimes there's like a misconception that SPECT is just something that, we're using. It's not just something that we're using. It's used commonly every day in clinical practice. It's just not considered necessary or standard for the medical workup, nor is it covered by most third-party payers for what we're looking at, right? So if a person comes in and they say, oh, well, I have low energy, I'm depressed, I'm not eating well, I have no motivation. If you say, hey, I want to just take a look at your brain, like you said, just like every other specialty of medicine, they look at the organ they treat, we don't. As a matter of fact, when you think about the specialties, there are 3 specialties for brain health in Western medicine: neurology, neurosurgery, and psychiatry. Neurologists look at the brain and it's reimbursed, right? They can get scans, they can get EEGs. Neurosurgeons, they're not going to operate on you unless they look at your brain. However, psychiatry, we're using a symptom cluster manual that has been revised over time to address symptoms, and it doesn't oftentimes lead to a full workup. And it's also a lot of times a financial barrier, because unless you have a certain diagnosis like a stroke, it's not covered. So a lot of people say, well, doc, I can't afford that. So working at Amen clinics, you can't go back for me. And let me back up and just say, using SPECT for daily psychiatric practice, I cannot go back. We're stuck in this guesswork framework that makes no sense. It leads to people being misdiagnosed. It leads to people being put on a lot of medications that cause other problems. And you should not medicate a person, in my opinion, for what seems to be the issue without doing all of the homework.
100%. About 18 years ago, I was bit by a tick. It took multiple years to get diagnosed, but the first clue for me for the diagnosis of Lyme was a brain SPECT, because the blood flow was not flowing
Optimal.
properly.
Mhm.
And they were basically saying, like, we see this in patients with lupus and also neurological Lyme disease. And I had so many neurological symptoms and had so many tests. And I was like, the first clue that I was like, okay, like I may have an answer. And then I went to see a Lyme literate medical doctor. We did additional testing with Lyme literate laboratories, and I also got the positive tick-borne disease testing affirmation. So it was
May I ask how
super
you got
helpful.
to the SPECT scan though? Like, do you recall how that?
So I actually was seeing a Lyme literate doctor, and he did he did a bunch of tests. He did like a PCR test, IgG test. I also did a spinal tap, which I feel like
He
there
gave you
were,
the kitchen
yes,
sink.
and then he also did brain SPECT. So he was like,
Okay.
there's something going on. I think it's Lyme disease. Let's look into everything and figure out, because yeah, your neurological, your nervous system is definitely compromised, and we need to figure out how to move you forward. And that was the first test and sign that moved me in the right direction. And
Wow.
so I'm curious, when you're working with patients and
Mhm.
they come in, what does it look like? What are some of the questions that you ask them to figure out, like, could they have had brain injury, and is brain SPECT something that we want to move forward with diagnostic decisions?
So our assessment starts from the core understanding and knowing that the brain is not separate from any of our other biological systems. So we start off with educating about those biological systems. And I usually explain to people, you've got 10 major biological systems. There are some that are really, really closely linked to brain function, which include your immune system, your endocrine system, which is hormones, and also your gastrointestinal system. And if you're having any neurological symptoms that you don't understand, we need to make sure we assess all of those systems. So our approach is called Bright Minds, and it ensures that with that mnemonic, we hit every system. So trauma is included in there. So is infection, hormone function, sleep hygiene, inflammation, toxins. And when you have someone that pursues SPECT, the image that we see allows us to evaluate the activity and blood flow, both on the surface of the brain and also within the structures that are deep within the brain. So we label those as our two views: surface and the deep within view, where you're looking at the limbic system, the cingulate gyrus, and the basal ganglia. That view has a finding that we refer to as patchy cortical uptake. It almost looks like a patchwork kind of lattice appearance on the scan, which should give you a high clinical suspicion for inflammation. And obviously, anytime there's inflammation, you want to consider, well, why is the immune system upset? I always tell people who I work with, you want to look at your immune system as your army. It's there to wage war on any intruder. So once the intruder comes in, their job is to find the intruder and attack. All of that cellular activity from the immune system can cause a lot of symptoms like cognitive issues, attention, brain fog, headaches, you name it. And so we see patchy cortical uptake. Another finding on the surface, which it's referred to as scalloping, but essentially what it looks like is almost like a cottage cheese appearance on the surface of the brain, because there's a diffuse loss of brain activity in the frontal lobe, in the parietal lobes, the occipital, and the temporal. So every brain system is affected. And I am a huge advocate for health literacy. Just taking a step back, most people don't know how to pursue advocating for their health because they don't know how their body works. And even when a doctor says, okay, well, here's your diagnosis and we need to do this, and this, most people leave like, okay, now what are we doing again? I don't remember what this is. So there takes a certain level of education, which is hugely involved in the functional assessment. We go through the brain systems on SPECT and explain how each system leads to different symptoms. I have one story I want to share because this was what really changed it for me. Starting at the Florida clinic for maybe about 3 months, I was also still seeing clients at our Chicago clinic because I still have my Illinois license. A young lady came in, she was about 9 years old, and she had symptoms of OCD and misophonia. So misophonia is an extreme intolerance of certain sound stimuli or auditory stimuli. And she was attacking her siblings. It was a real problem. If they chewed, if they did anything that triggered her sound sensitivity, she became aggressive. She was always agitated. The parents were really, really confused as to what was going on, and they had gone above and beyond with taking her even to a misophonia specialist. And so, of course, the scan was done, and she had really, really severe patchy cortical uptake. Like the whole scan with that view just looked like a lattice. That's the best way I could put it. And so I explained to them, now that we've confirmed this, I really think we should be looking for some underlying cause for the OCD symptoms and for the misophonia. And I educated them about how inflammation in the brain due to a pathogen, a bug, can cause certain symptoms like obsessive thinking, compulsive behaviors. And we were able to get her diagnosed, and she was diagnosed with Babesia by our functional doctor, Dr. Plant. Shout out to Dr. Plant. It's one of my favorite colleagues. He worked it right up and said, oh, she has Babesia. So that was a game changer for me, because when I think about how I would have approached her treatment plan in my outpatient practice back in Illinois prior to all of the functional training from Dr. Amen, she would have left my office with an infection that I wouldn't have found.
Dr. Gettings, I just want to just real quick recap some of the things you discussed, but also discuss some complexities or problems with this approach and how you've overcome them. So first of all, I like the way you describe a CT scan versus SPECT scan, right? Structural, basically just how it's structured. Is there any damage, trauma, right? You have a concussion, you banged your head, is it inflamed, etc. Versus activity. And activity means, I think, blood flow activity in the brain, and at the surface level, as you described, but also in the deep structures as well. So there's two parts to looking at that activity through a SPECT scan.
Correct.
But you know, we've encouraged many of our guests to get SPECT scans because we've heard from doctors like yourself, including Dr. Brian Plant, who we've had on the podcast and absolutely love and adore. He was amazing. That, you know, they should get these scans. The problem is many doctors don't, A, won't issue them. B, they're not covered by insurance. But even if they can get the scan, doctors tell people, we don't even know how to interpret the scans, right? So that had to be a hurdle for you. How did you learn how to interpret these scans and identify, hey, this particular uptake flow within the brain can be correlated with an infection, and therefore you should test for Babesia, right? That sounds like a whole niche specialty in medicine of its own. So is that a problem or a hurdle we need to overcome in the MD community so people can learn how to interpret these scans and better serve, you know, their patients as a whole?
Absolutely, because we're neglecting people a lot. The hurdles have definitely been the financial barrier for sure when it comes to third-party payers reimbursing for services, imaging. They have their own set criteria of what the concern needs to be. So if I am depressed, insurance does not cover for me to get a SPECT scan. If I say I flew through a windshield and I think I may have had a brain bleed, then yes. So that needs to be addressed. We need to broaden our understanding of where SPECT is useful and should be utilized in the clinical workup of any brain health issue, and just let me take a step back for a second, because this is a problem that I really have. You can have someone that is depressed, psychotic, or anxious. And because the areas of the brain that control those symptoms are associated with emotion, feelings, behavior, we don't look at that as the same as if somebody falls out on the floor and is having a seizure. If I'm having a seizure, I'm going to work you up SPECT, CT, MRI, with, without contact, EEG, everything. So why are we looking at it any differently? Wherever the inflammation is, I look at the brain as like a fuse box, okay? Whichever fuse would I follow that, follow the wiring, and you'll find your problem.
Right, it's a breadcrumb, right? It's a breadcrumb that leads to subsequent things. But I think it's deeper than just psychiatric symptoms versus a seizure, right? It's also a patient walks in with non-specific symptoms, right?
Yes.
Chronic pain, autoimmune inflammation-driven symptoms, right? Just general depression, maybe insomnia. All these things should, to me, indicate let's do a SPECT scan so we can identify the parts of the brain that are impacted and try to reverse engineer or follow that breadcrumb to identify what is the root cause, not just treat
And
them with
follow if
psychological
your treatment
symptoms.
is working.
Right. Now, I guess the question I have is, how do you know what parts of the brain are correlated to what pathogens or what other things? Because it's never just a psychological symptom, I don't think, right? Generally something deeper, as you're describing. So how did you learn that? That's really my question, is how did you learn
How did I learn it?
what this part of the brain's lit up? That's correlated to this, right? That's what I'm really
Yes,
fascinated
I learned
by.
it by living in Costa Mesa for 3 weeks because I went to train with Dr. Avis. So when he, when you start working with him, there's like a brain spec boot camp, if you will. I mean, obviously we're already trained physicians. In our training, we look at images, right? But we're not using them every day in clinical practice. So it's not that steep of a learning curve, if you will. You're coming with all of this knowledge and now you're applying it in a different way that you weren't trained to in your psychiatric residency. And so, that piece just comes with the immersion and understanding the brain systems and what SPECT is showing you and the science behind that. The problem that you mentioned, the third problem, which is once I get my SPECT scan and I go take it back to my psychiatrist and they say, well, I don't know what this means, but I think you should still stay on your Seroquel. Yep. Or let's go as far as to say, I didn't mean to name a drug for real, but sorry, stay on your medication. When you think about how imaging is dismissed when it comes to psychiatry, and it's because of how the diagnostic structure is. It was structured to not include these tests. It was structured to not include even some lab tests, right? So we're going a step ahead with talking about scanning your brain. You can walk into a psychiatrist's office now in 2024. You can pull out the diagnostic manual, check, and you can leave with 1 or 2 prescriptions with no physical exam, no blood work done, no imaging. So what I would tell people that have any question about it, just take a step back and think, okay? If I come to the ER and I'm short of breath, what are they gonna do? They're gonna get a chest x-ray because they need to look and see, well, maybe something's wrong with the lungs. They're also going to do some blood work. Why is it so far-fetched that if I'm having depression, fatigue, brain fog, that there could be something underlying that's infectious or toxic? I just don't understand why that's so far-fetched, but the only thing that I can conclude is because we're not taught those correlations. We are taught, I don't want to say not taught, but it's the Lyme literacy piece, I feel, is definitely not something right now in residency programs for psychiatrists. The whole infectious immune or psychoneuroimmunology, it's in its evolution. That is not what it's been. From the moment you walk into medical school, and if you look at the degree, it says you have a doctorate of medicine. That's what we learn. We learn a lot about pharmaceuticals from the moment we walk in.
Yeah, I think the system is broken, right? And I think
Very.
all of us listening probably agree to that. My final question before, well, not my final question, but my question before I shut up for now and let Michelle pick back up is this. What are you seeing with your tick-borne disease patients, right? So anybody who has chronic Lyme or Babesia or another tick-borne illness, what are you seeing on these SPECT scans that is unique and different? So people listening, if they want to bring this to their doctor and say, please do a SPECT scan, I'll pay out of pocket, or they want to come see, an AMN doctor if there is one locally, what are you seeing that can be a common thing within the results of the scan that people can share with their doctors if they're willing to do a SPECT scan for them?
So they can see inflammation. Essentially, that's what they're going to see. And we use two different terms for inflammation, depending on which view of the brain we're talking about. So if it's the surface, we use the term scalloping. A person who has scalloping, there's inflammation there, which is why that image appears that way. If we're looking at the deeper structures, you see the patchy cortical uptake is what it's called. Now, if you show that to a doctor who's not been trained to use SPECT and apply it to anything with functional psychiatry, they're just going to say, I don't know clinically what to make of this, but we can work you up for Lyme if that's what you think. And then that's where we run into another problem, which is the testing. And what testing are they using? Okay. So there's those two real barriers. But here's what I would say to the audience. Go to AMN Clinic's website. On the tab with conditions, you can see an example of every SPECT scan that correlates with different diagnoses, from ADHD to PTSD to TBI to infections, toxins. That's the first thing that we do, is learn how to tease out. And this is the part that I always drive home to people, because a lot of people come and they say, so if I get a scan, then you'll be able to diagnose me. Or this person said that I have this diagnosis. Will the scan show if that is true or not? Think of it the same way you would, going back to my example of I'm short of breath and you get a chest x-ray. If I get a chest x-ray and the right lung looks like it's filled with fluid, do I have a diagnosis? No. I just know your right lobe is filled with fluid. I still have some homework to do. So you need to look at SPECT in the same way when it comes to working up any psychiatric presentation. It is a tool in your toolkit. It helps you to get to the right answer. Someone who has sleep apnea and no Babesia and no Lyme, their scan doesn't look like someone coming in with Lyme, okay? So, yeah.
So a huge takeaway, I feel like, is inflammation in your brain can cause a lot of different neurological conditions. And when we think about inflammation, it's like, okay, well, where does inflammation come from? It can come from toxins like heavy metals, mold mycotoxins, other environmental toxins. It can come from pathogens like viruses, COVID, tick-borne infections. It can come from also, that leads into autoimmune conditions. And like you said, everything's connected. Gut conditions, inflammation in your gut can cause inflammation in your brain. And then also accidents. So seeing all of these different factors playing a role in inflammation in your brain, what is the next step that you take after looking at that brain SPECT? And okay, yep, we're definitely seeing that there's something going on that's causing your symptoms. We're seeing that there's inflammation, and I am suspecting, it seemed like with that one case, you were suspecting tick-borne infections. So the patient was tested, she came out positive with Babesia, and then you had really a diagnosis on how to figure out the best treatment moving forward and make it more individualized. What does that look like in your practice for people that have brain injury due to playing football, or brain injury especially with children with PANS and PANDAS? I'm sure that the treatment plan becomes different in some ways, but then also it's about supporting your mitochondria and and healing you on a cellular level. So I also think that it probably overlaps in treatments that we would do in the tick-borne disease community. So I'm just curious on what type of treatments, how do you navigate that in your practice?
So for sure. So once we have evidence from an imaging tool that there appears to be inflammation, you have to take a good history. That's the core of medical diagnostic workup with any presentation. And so using that as a tool, I'm now able to see, oh, well, your immune system isn't really happy. That's what I see when I see inflammation. Something has your immune system upset. I give the analogy again. If you have a home and you've got security at the door and someone breaks in, security goes to secure your home. But while they're doing so, your lamps are getting knocked over, somebody kicked the couch, somebody tossed, you see my point. So you're damaging the home while you're trying to actually kill the intruder. That is inflammation, whether the intruder is a toxin or a bug or, right? So why is your immune system upset? When I do my history, I like to do a timeline. Start prenatal. Take me to where we are now. And you ask those key questions. What are the risks of exposure that you've had potentially to Borrelia or Bartonella or any of these bacteria? What other exposures have you had? And so you want to know where did they live? Where did you go to school? I had a patient maybe 2 months ago, very, very, very sick, was exposed to mold for almost a year, for an entire academic year, and has Lyme. Okay, so and everybody's immune system obviously is not the same, right? I may be able to eat a shrimp po' boy, but you might fall out in an anaphylactic reaction if you eat a piece of shrimp. So think of that. That's all immune system. If a person has anaphylaxis, that's their immune system trying to attack the intruder. So once you know it's inflammation, then it's a process of elimination. Dr. Amen tells us when we start training with him, now MD for you means medical detective. And I take that job very serious. So I start doing all my detective work. If a person says, well, yeah, I think maybe I did get bit by a tick. I had one little boy tell me I pulled 2 right from my armpit. I said, oh, okay, well, let's test and see if you have any vector-borne diagnoses. And then I kind of educate them about that. The other inflammatory causes, like you mentioned, environmental toxins, there are tests that we can do for that as well. You can do urine mycotoxin tests. You also don't want to forget about your hormones. A lot of times when we have infections, your body is in this chronic state of fight or flight, and the cortisol is dysregulated, DHEA, and that's affecting mood. And so the treatment obviously depends on what you identify as the culprit. But if it's a TBI, let's say, causing inflammation, traumatic brain injury, NFL player, Dr. Amen did a very large study on NFL players. And what we have found is that what helps is hyperbaric oxygen, which really should be a no-brainer because that's what they use in hospitals to heal wounds that are not healing, in burn victims, in people that have experienced amputations, but it's not paid for if you have a TBI. So now we're back to a third-party payer issue. And if you have a TBI, you can't just do HBOT 1 day a week. It should be consecutive. There's a protocol that's been proven. So for that, a lot of oxygen, a lot of supplements that are known to decrease inflammation as well when it's from a physical trauma. Now, when the inflammation is from a bug, those nasty little critters, whether it be bacteria, a virus, or one of the fungi, aka mold, right? Then it's going to be different. We're going to put together a treatment plan that would eradicate that pathogen and also include a lot of immune support. Some glutathione, N-acetylcysteine. Our DC clinic has just opened up a neuroinflammation program that is led by Dr. Ebony Cornish, who's another functional doc, yes. And I mean, it's been a game changer. Like, it's a 2-week, just intensive, full workup, SPECT scan, really get your answers, and then provide a lot of these a lot of these treatment options, but a little more aggressively, not orally. You're getting it IV in the clinic, okay? The last piece that would lead to inflammation, brain inflammation in a lot of folks when it comes to toxins would be our voluntary toxins. So I see a lot of inflammation for people that are using cannabis, other substances. And what I do is I educate them about how it's affecting their brain, and it helps to motivate. I find when it comes to substance abuse and substance dependency, even though I know that's not the topic for today, seeing the effect on the scan, being able to go through a treatment program and coming back to do a respect, game changer. So that's how we work it up.
Dr.
The
Gettings,
inflammation just tells us.
can I jump in and ask a question about that? I just want to make sure, maybe I'm confusing two different things here, but we have a lot of people listen to this podcast and a lot of people who have been on this podcast to describe using, whether it's CBD, THC, or just recreational weed smoking as a tool to decrease inflammation and help calm down their brain. But it sounds like there might be a counterproductive component there, or did I misunderstand that piece?
No, you didn't misunderstand it. So when it comes to cannabis, obviously we have hemp and we have marijuana, right? And so anything derived from hemp, since the Farm Bill, you can get over the counter, but the substance that you're predominantly getting there is cannabidiol, aka CBD. If you're talking about marijuana, now we're talking about a much, much higher level of a different type of cannabinoid, which is THC. We as humans have an endogenous cannabinoid system with two main receptors in the brain, CB1, CB2. When you look at the cannabinoids, we have over 100 different cannabinoids in that plant family, okay? So what I do is I first educate people about the differences between the cannabinoids, because you don't have to use THC to decrease inflammation. There are other cannabinoids that are able to decrease inflammation without causing the psychoactive effects that THC causes. The other piece that I educate them on is the route, okay? If you inhale, that's the fastest way to get it in your system. So a lot of people who have, really high anxiety, well, I need to, inhaling smoke is not good for you, period. So even if it's a healthy substance mixed in with the smoke, that's not good for you. So I encourage the usage of tinctures, which gives you really fast absorption as opposed to, edibles or things like that. Obviously, we also have topical, we have suppositories. I mean, I have been a medical cannabis provider for years, from when they started the pilot program in Illinois to even here in Florida. But it's all about education, because cannabis used to be in the pharmacopoeia of medicine, but it's kind of, I call it throwing the baby out with the bathwater. Like, THC can definitely cause a lot of problems, but it is such a complex plant family. You don't want to lump it all as to THC. You want to be educated about what cannabinoids are, what receptors you have, and what each type of cannabinoid does.
In the context of a Lyme patient, do you think cannabis is something good for somebody struggling with inflammation and also psychological symptoms?
So I would say that cannabis is good for inflammation depending on the cannabinoid. I would be very, very opposed to someone who's having psychiatric symptoms in the context of Lyme using THC. That's a risk for sure. Is it a guarantee that it'll be it's a risk for sure. The biggest risk, when we go back to just brain health and SPECT and what we see, is lack of brain activity. So we know that inhaling cannabis and robbing that hemoglobin of that oxygen molecule, you're going to decrease blood flow, you're going to decrease mitochondrial activity. And those are sometimes some of the worst scans we see when it comes to scalloping. The temporal lobe, which is the part of your brain that's right behind the temples, it also happens to be part of the brain that's very susceptible to injury. that happens to be where cannabis tends to have a lot of activity. It houses our hippocampus, which is your hard drive, which is why people sometimes can struggle with memory. To simplify it, let me just say this. THC binds to receptors in the brain very differently than other cannabinoids like CBD. Okay, so if you're going for no inflammation, you don't have to go for THC.
Okay, but cannabinoid treatments can still be helpful if you're using the right one and if it's well
Correct.
sourced for helping with decreasing inflammation. Also, people in the Lyme community oftentimes deal with seizures, so those treatments can be brought on board to help with monitoring and modulating seizure conditions due to the tick-borne infections. So that's helpful to know that you really want to make sure where you're getting it and
And what percentages of what, like when people
yes.
say, oh, well, I'm using medical cannabis, that means nothing to me. I
Mhm.
say, oh, well, is it a hybrid? Is it indica? Is it sativa? What percentage of THC? What percentage of CBN? What percentage of CBG? What percentage of CBD? Like, you can't oversimplify using cannabis like that. So,
And
and I
it's
think that's part of the reason why we didn't have access to it for so long, when it can be one of the most potent anti-inflammatory substances that we have. But you've, again, going back to my throwing the baby out with the bathwater, if you say, oh, well, this one cannabinoid is what causes you to have a higher risk of psychosis, which is true. I will tell you all right here today, I have seen too many people come into the hospital after being exposed to THC, and they are in an acute psychosis. So there is no question for me whether or not THC can cause psychosis, but it goes back to the individuality of it. I don't have your DNA, you don't have mine. We're all different. So how your body responds to something just genetically is going to differ. Now add on head trauma. Now add on mold. Now add on Lyme. You're playing Russian roulette. So you have to be educated before you start pursuing different treatment options. And I feel the same way when it comes to people that, for lack of a term, poo-poo cannabis, or it's just a negative across the board. When I live here in Florida now, had a patient, shark bit his arm off. He didn't want to have to take opiates all day. That's what his option is through pharmaceuticals. It's opiates. It's just another receptor, but he couldn't function. He's like, I can't even think with taking this. So he wanted to pursue medical cannabis for his chronic phantom limb pain, and it worked. You have elderly people, bedridden, who are in so much pain. Topical cannabis helps so much with inflammation in the joints. So no, I think that we would be making a huge mistake to tell people that cannabis doesn't help with inflammation. Just have to educate them on what part of the plant or what substance from that plant they should be using.
so that just emphasizes the importance that if you are going to use it, you really want to make sure that you're monitored by a doctor that really understands what's going on in your brain to help you figure out what would make the most sense for you moving forward. The other thing that I want that I wanted to touch upon that you mentioned earlier is mold mycotoxins and then different strains of tick-borne infections. Oftentimes in my practice, I see that people will come in with depersonalization or derealization, and those are usually red flags for either mold or Bartonella. So it's always interesting how different types of mold spores or different types of tick-borne infections can show up. Even in like mold mycotoxins, I noticed that the mycotoxin Wallemia, if people have really high levels, they show signs of like suicidal ideation. Same with Stachybotrys, same with Catonium. So it's really so important to understand where the inflammation is in your brain, the root cause of it, and then figure out, okay, well, where do we go moving forward? How are we going to get these mycotoxins out of your system? How are we going to get this pathogenic load lower? And then from there, you're still left with almost like this dysregulated nervous system, because people are not meant to suffer for this long. And dealing with these conditions, mental health in general is so misunderstood. So it's traumatizing. It's really traumatizing to go through these conditions.
And a lot of people avoid, you know, pursuing any type of anything that says psych or mental. And one of the main, I guess, principles of working with Amen Clinics is we just call it the brain. Like yes, the brain leads. How does Dr. Amen say? Get your brain right, your mind will follow. So we're gonna focus on the brain, the mental will come, okay? So when you just put it that way and you just look at the stigma, when I trained at the University of Illinois in Chicago, I worked at the Juvenile Detention Center, which was across the street, with children who were incarcerated. I also worked on an inpatient unit with children who were in foster care who had failed up to 4 foster homes and a group home. And ask me how many of them get scanned.
How many?
And just think about that. Just think about that for 1 second. You have a whole population of children who were removed from abusive environments. Don't you think you would want to make sure that they don't have any head injuries? Because they would appear to be at a higher risk. And so, but instead, we don't do any imaging. We evaluate and treat. And what they're treated with a lot of times are antipsychotics that are being used to treat aggression, mood dysregulation, and these things that are coming from their completely unhealthy upbringing. Not treating with therapy, not treating it with a scan, definitely not giving them any HBOT. And what are we doing? So it's across the board, like what you're saying in terms of the symptoms that people have when it comes to like dissociation, depersonalization. We shouldn't just look at that in the DSM-5, check some boxes and say, well, sounds like you meet criteria for schizophrenia. Because that's what's happening. But to me, it sounds like you have something going on with your temporal lobes. We have a brain systems handout. The major brain systems that we image, frontal lobe, that's the CEO of the brain, right? Executive functioning. Cerebellum is in the back, balance, coordination, and it's known to house half of our neurons in that one area. I refer to it as the secretary. It's constantly communicating with that frontal lobe. Parietal lobes, sensory input, direction sense, right or left, right? Think sensory. How many people who have Lyme, light sensitivity, headaches, touching them, just all of these sensory input issues. Now, I think, okay, well, the parietal lobes are definitely being impacted here. Lastly, on the surface, you have your temporals. That's where things can get really, really unhealthy when they're affected, because the delusional, the dissociation, all of those, the dark thoughts, SI, all of that, memory loss, confusion, anger, rage, all is housed there. And if you don't look at someone's brain and you treat them with a certain medication, you can agitate those temporal lobes. We see the same thing in people with epilepsy. You give them a certain medication, like a serotonin reuptake inhibitor, you might trigger a seizure. So it's so important for the safety of the person to get an image first. On the interior of the brain, we look at the cingulate gyrus, basal ganglia, and the limbic. This is how I simplify it. Basal ganglia, think of your fight or flight. When we see a lot of activity there, we're usually seeing someone with some high anxiety, panic disorder. They may have generalized anxiety, social anxiety. The cingulate gyrus, think of it as your brain's gear shifter. There are some people that struggle with being very rigid, very strong-willed, very opinionated and argumentative and all those things. So on our brain systems handout, you see all of the functions. You also see the symptoms when that system is not working right. And then we break down the treatments, both medication, nutraceutical, and behavioral. And we formulate a plan and we work as a team. I cannot take credit for the young lady with Babesia and misophonia. I probably hadn't heard of Babesia since med school. But what scares me is that I may have seen several kids with it along the years, and I didn't do what I was supposed to because I wasn't Lyme literate, okay? So health literacy is so important for me, and I just want to speak on being a minority and in our culture and community. Not trusting your doctor compounded with not understanding is a huge, huge downfall. Even when there's trust, I find a lot of people just don't understand. How can you understand what you're treating if I said to you, well, your cingulate gyrus and then your basal ganglia and then I don't know what you're talking about. So, the lack of knowledge is hugely important, not only for the individual getting the treatment, but also for the doctors. Because I'm going to go back to what you said. What do you do when the doctor says, well, I don't know what to do with this? A lot of times they're not dismissing it. They're telling the truth. They don't know what to do with it. They have not seen a brain image since residency, and they were never trained to apply findings on a functional CT scan to symptoms of neuropsychiatric presentation. I was never trained that. When we look at imaging during our psychiatry residency, when we're on our neurology portion of our rotation. That's when every day you're looking at MRIs, CT scans, EEGs for people that are coming in with epilepsy, myasthenia gravis, all of these different neurological diagnoses. But once you get to your psych rotations, who's getting scanned?
So it seems like, yeah, for listeners out there who are battling mental health issues, it is great to have resources like you that understand all of the different factors that can be contributing to mental health. Once you do have the answers of some of the root causes, I know in treatment you had mentioned hyperbaric oxygen chamber therapy. Is there anything else like phosphatidylcholine infusions, glutathione infusions to get toxins out, or even diet? Can you talk more about some of the ways that you can treat and help some of these symptoms dissipate and people move forward?
Yes, I have a middle-aged man here in Florida came to me because he was psychotic, he was paranoid, and he had black mold in his home. I left Chicago because I was tired of the cold. I did not know I was moving to the mold, okay? So once I got here and I started scanning people, and Dr. Plant was like, well, mold's everywhere, like we're all exposed to mold, so you kind of just can't. But clearly some people's immune system doesn't respond to it the same, and it also depends on how much you're exposed to. But that said, this man was not well, okay? Not well. And his wife was terrified. She'd never seen him like this. And they took him to the psych ward and nobody did any scans. I don't know what all blood work they did, but when I consulted with the doctor, I explained to them, this man has a history of mold exposure. We really need to get some imaging and some additional lab work. And I was able to get him to get SPECT because still at the hospital, they're not going to give him SPECT. They're going to give a head CT, and most of the time without any contrast, which makes it even less useful. So that being said, I tag teamed with Cornish. So let me say this. I am not functionally trained to tell you, take this much glutathione, and now we're going to start this Myers cocktail. And, I'm not. But I am there to treat the symptoms that are present while the underlying issue is addressed. He was paranoid out of his mind, okay? So I'm coming in to help with the psychosis and working up the underlying issue. Dr. Cornish came in with her recipe of healing, and last week I signed for him to go back to work. I can tell you it included antifungals. It also included foot soaks. It included binders to get the mycotoxins out. But when Dr. Cornish gets in there, I don't pretend to know. I just am in awe for the most part. Okay. So where I am is I want people to get the answers that they should get. If you go to the doctor for help, you shouldn't be told your symptom is your problem. What Dr. Amen always emphasizes is in psychiatry right now, we diagnose people with their symptoms. You're depressed? Oh, got major depression. Anxious? Oh, well, you got generalized anxiety. That's like saying, oh, I have chest pain. Well, you got chest pain syndrome. No other specialty does that. Why are we doing that? And I'll leave that for other people to figure out on their own why that would still be in place. Why is there such a huge barrier of just looking at the brain when it comes to psych? The history of psychiatry is horrendous. People avoid because of that history. You could lose your freedom. People still don't talk to psychiatrists sometimes because we're the only doctors that can hospitalize someone still against their will. And so it just creates this huge barrier for trust, and it creates a lot of avoidance. And so what I always do is I explain to someone, if you wouldn't be ashamed to tell someone that you have hypertension, then you shouldn't be ashamed to tell someone that you're hearing voices, because hearing a voice is a function of your brain. So if that part of your brain is not working right, or it's inflamed or misfiring, you might hear a voice that's not there. So it's all about normalization. Then the treatment is everything. Fix the pathogen. If it's mold, antifungals. If it's bacteria, antibiotics. What Dr. Cornish and the other functional docs emphasize is the duration. Whatever this standard protocol is for treatment of suspected Lyme in your typical outpatient primary care practice, from my understanding, is like 3 weeks max of maybe doxycycline, amoxicillin. And chronic Lyme, when you think about the bug, the spirochete that's hiding in your tissues, that's not going to do it. So that's why they've opened up the neuroinflammation clinic in DC, because it has all of the things that you just said, from HBOT to the infusions of IVIG or glutathione or Myers cocktail to IV antibiotics to even IV antifungal. And that is usually what a treatment plan would consist of. But the specifics of it, the duration and all that, I trust the experts like Plant and Cornish.
Let me just jump in and say one thing here, because I feel like you're underselling yourself in so many ways, right? Because
Okay.
I'm going to play devil's advocate. Somebody would come in and say, hey, Dr. Gettings, you just described yourself as a Band-Aid, right? Like I don't do the real healing from Lyme. That's where Dr. Cornish comes in, but I can help you with psychosis. But, I want to argue that what you're doing is super important. And we know it's never one doctor to help somebody get better. It's a team of doctors, a team of specialists, and the patient has to be a part of that as well. But what I'm seeing here is so many people in this chronic Lyme community are in crisis and they need immediate assistance. Otherwise, they may have these suicidal ideations. They may have these other things going on that they need immediate help with. And that's where you come in, right?
Yes.
But even deeper than that, and again, it's not a Band-Aid. We had a guest probably 3 years ago use the word bridge. And I like that word because a bridge is a term that allows you to calm down the immediate problem to be able to walk over that bridge to get to the deeper level healing, right? Like the more core healing. And I think that's what you allow, is you form this bridge to calm down the immediate fire and allow them to get to the deeper healing. But more importantly, the treatments by Dr. Cornish, for example, may not work at all or may not work as effectively if you don't do your piece. And what I mean by that is if you're not calming down the psychosis, if you're not calming down the inflammation, if you're not pulling down that fire a little bit, then you know what? The treatment they're getting on the other side may not work at all. So I think it's really this comprehensive approach. And they may not take it. Correct.
Dr. Cornish say, I think we might need to go up on those Zyprex. Because person's paranoid, they're paranoid. They're not taking that. And when you look at all these supplements, I'm not taking that. So no, I didn't mean to suggest that I don't, that my role in the treatment outcome isn't the same. But what I will say is it's, maybe I should say it as more of as a multidisciplinary approach. I don't want to jump in knowing I'm not formally functionally trained. I haven't done any integrative formal training and take that away because they have. But I have stalked Dr. Plant and Dr. Cornish. So at this point, I'm right there, especially too when you think about the wait, because there aren't a lot of Lyme literate doctors, so they're booked. And what I can at least do now that I work with our team is get the ball rolling. Like, I know all the labs to order, I know who to order them from. I definitely know how to interpret them. I just don't provide that part of the treatment plan in terms of like dosing the antibiotic, duration, etc. But yes, we, just like the system, excuse me, just like our body, we are multi-systemic. So I'm there to address those acute symptoms that for a lot of people, like you said, can be very dangerous, can result in really, really bad outcomes, especially with Lyme and suicidal risk, because the rage there, especially in adolescent males that I've seen and now recognizing it, is huge. And they react in a way that's very, very, I mean, I call it enraged and inflamed. Like, it's just, there is no regulation because their brain is so inflamed. But you'll have a doctor who's not Lyme literate, and you bring a child in who's just having all of these meltdowns and these really, really aggressive behaviors, and they'll be diagnosed with intermittent explosive disorder. What is that? Seriously, like with the whole ICD-10 code and a script for Abilify.
Yeah, we definitely have a long ways to go. I will say that listening, like just being here, talking to you, is really reassuring that there are Lyme literate psychiatrists out there. When I was 23, I knew I had just been diagnosed with tick-borne infections, and I was dealing with severe depersonalization, derealization, really bad depression. And I had never had any anxiety issues or depression before that. And so I was recommended to a psychiatrist that was supposed to be Lyme literate. And I'm a pretty private person, and I also was embarrassed of these symptoms. And so I was telling her, like, I don't feel like myself. It almost feels like I'm watching a movie of my life. And
Which is
this
a
was
sign
another
of
weird
brain
symptom.
inflammation.
Yeah, and I'd be like, I'm looking at my hands and they don't feel like my hands. And she was like, well, do you think you need to be hospitalized? Do you think you need to be put in an institution?
Are you safe?
And at 23, I'm young and I don't understand tick-borne infections and how it's creating these symptoms due to inflammation in my brain. And I left that appointment, and I remember I didn't really talk to a lot of people about this, but I called my best friend Taylor, and I was like, Taylor, like, I think there's something really wrong with me. Like, I think just too much has happened. Like, there's been too much trauma, and like, I'm the reason why I have so much anxiety and depression. And she was like, Michelle, no. Like, you have an infection in your brain that's causing inflammation. You're never going back to that psychiatrist again. And I so wish I had someone like you at that point, because it was such a confusing time. And yeah, it just to have someone believe you and that there's inflammation in your brain and that there is ways to move forward is a game changer, because at that time it was so difficult for me to be like, this isn't me, like, this is inflammation, and like, it's not my fault. And so really just giving people that understanding and that support is huge, because there's so many psychiatrists that don't understand that piece.
Yes, and think about the man. Think about what you just said, right? Like, you would have been given medicine indicated for depersonalization, disassociation. No one would have worked anything up. And so here we are just treating your symptom, which is the problem. And I'm very disappointed that I left University of Chicago Pritzker School of Medicine, shout out, and did not understand the implications of vector-borne illnesses. My father is a Vietnam War veteran. I actually learned about vector-borne illnesses at home because he caught malaria. My father stopped taking the medicine to prevent malaria when he was in Vietnam at 17 because he said I was going to get killed. So he said, I'll take my chances. I'll just catch malaria. And he always tells how he almost died, like just how high his fever was, everything they had to do in order for him to survive. My father is now 78. He has a lot of symptoms still. He has Bell's palsy that he developed like when I was maybe 5. I remember waking up and his mouth was just twisted to the side, all of these neurological symptoms. And I just take a step back and I say, we need more education, period. Because I don't think it's that doctors don't want to acknowledge. Most doctors don't understand because they weren't taught it. There's also the other layer of there's no money in cure. If you go that route, we are a nation that has a lot of chronic illness, right? Lots of chronic illness, lots of chronic medication management, and we're not really talking about reversing anything. I know the young man that just had the exposure to the black mold, if he had been at the wrong place, he would have been restrained. He would have been medically restrained. If I hadn't called and explained to them what I knew about his home and everything that had happened, who knows, right? And so, and that's how people get labeled with these primary psychotic disorders. If you look at statistics, primary psychotic disorders are not that common, okay? I would just want to say one other thing I have to about the medicine piece, because if you start treating people with medications and you don't really know what the problem is, you can really, really mess some things up. And so the medications that we use target dopamine, serotonin, norepinephrine, all these neurochemicals that do so much. Why would you even expose someone to that without doing all of your homework? And so where I stand now is it's beyond this should just be standard of care. Like what we're doing is negligent. I will say that, okay? And I feel like I have probably neglected a lot of people that I came across prior to training with Amen Clinics because I wasn't taught this. One other piece that we can see on our scan that was a game changer for me as a child psychiatrist. I work with a lot of kids who are being abused, and understanding how to get that information, protect them, that whole, everything that goes along with that can be very stressful and difficult. I had a young lady maybe 5 years into my career who was being abused by her own father. I treated her for almost a year before she told me, and he brought her to every appointment as though he was so concerned for her well-being, okay? Eventually, I was able to just figure out for myself and observations that something was very off, and I strongly encouraged her to tell me, and I assured her I would make sure she was okay. Fast forward, when I started working with Dr. Amen, a patient came in. Chief complaint from mom was that some bizarre behavior, paranoid about food being poisoned. We scanned her brain. She had classic finding that we see with PTSD, which we call the diamond pattern. It is high activity in the cingulate gyrus, the two basal ganglia, and the limbic. It makes a diamond. Anybody listening, go to Amen Clinic's website, click the PTSD tab, you'll see what I'm talking about. This girl's scan had a diamond pattern that jumped off the screen. And so I said, I need to speak with her alone. I can't, assessed. She told me, I was comfortable telling you that my mom's best friend is abusing me because you just told me that my scan confirms it. Because otherwise, nobody would have believed me.
And
Game changer.
Yeah, I think you bring up a good point of just childhood physical and emotional abuse. And one, physical abuse can cause inflammation in the brain. And two, emotional abuse can make your limbic system definitely more heightened. And
Correct.
so we've seen that there is a correlation with people with children who have had a childhood trauma to grow up and have chronic illnesses due to there just being so many hits to the body of like, okay, being in fight or flight stage your
Correct.
entire childhood.
Which impairs your immune system.
Exactly. And then maybe you get COVID or you have a mold exposure or you get a tick bite, and then it all kind of tumbles and it's like a perfect storm. And
Yes.
so trying
A
to
cluster,
really,
you know what? Yes.
yes, and just trying to really figure out, okay, like let's peel this onion, let's work through this trauma, let's get this pathogenic load down, let's get these toxins load down, let's figure out how to regulate your limbic system and your nervous system. And it is a team approach. It is, yeah, very difficult, but it's great because a lot of doctors don't specialize working with children. So people will come in with pans and pandas, and they'll have a child who was completely fine prior, and then something will happen and they have like severe eating disorders or OCD, or they're violent. And there's a lot of physicians that are Lyme physicians that don't take children. So it's nice to also have someone like you that can help navigate this process while working as a team in getting that child better.
Yes. I work here in Florida at a partial hospitalization program called Galen Hope, founded by Dr. Wendy Oliver Pyatt. She's really well known in the space of treating eating disorders. And so that's really our focus. And I have, with my training, I have been able to incorporate screening for vector illnesses at Galen Hope. We had a client who came in with intermittent explosive disorder. I won't go into all the details, but bottom line, I did a full workup and he had Lyme and nobody knew. And so I gave some information just about Lyme rage. I kind of explained to mom. She said she always knew. He was there though because he had ARFID. So the other piece that I want to say, a lot of our children with neurodevelopmental diagnoses, we know their gut is different. We know their immune system is different. Their brain, their body is all different. So how they respond to infections and how their immune system creates inflammation sometimes is so much worse. And if you have a child that's experiencing the aftermath of strep and now they have acute onset of OCD, the answer shouldn't just be give them some Prozac or CBT with exposure therapy. You should be helping decrease inflammation. That's the goal. So the system creates chronic conditions. And I want to see people get better. I would love to know too, and if it's not the time to discuss that here, but what led to your, healing, and like what were the things and the tools that you had to utilize? Because what I'm starting to see is it's different for everyone. And what I definitely see is that the more compounded, if it's vector-borne illness, mold, mercury, it's a different treatment path, and it can be longer, and it can have ebbs and flows. It can get better and then 2 steps forward, 2 steps back. I see that. And then I see the man who had the mold. Oh, let me say this too. He was using THC. Soon as he stopped, that really helped clear. So another take-home message, if you've been exposed to mold and you don't know, or any infections, how you respond to cannabis will be a lot different than somebody else. So,
Yeah, that makes sense. I know we talked a lot about like behavioral changes when dealing with inflammation in your brain. The other thing that I wanted to touch upon is, so I work with hospitals that offer hyperthermia treatment, and this one hospital, their clientele is people with neurodegenerative disorders, movement disorders, and Alzheimer's. And so when I was doing their pre and post treatment, I tested them for tick-borne infections and environmental toxins, and there were red flags everywhere. Everything was elevated. So I also found it very, very important, and also just like, no one's really talking about this, that Alzheimer's and cognitive function can have a huge correlation to tick-borne infections and environmental toxins. And even with me, like, I was put on Namenda when I was in my early 20s, which is a medication for Alzheimer's.
Mhm.
And that should have been a red flag. Like there's something going on because you're 23 and you shouldn't be having memory issues.
Mhm.
And then, that brain spec was really helpful. Getting the diagnostic testing, having a positive tick-borne test was really helpful. I ended up doing hyperthermia treatment. And then I
Mhm.
did a really deep dive into nutrition,
Mhm.
more of like a Mediterranean type of diet to really give my body
Stay
the
away
good
from
fats.
inflammatory foods. Mhm.
Yes, I did phosphatidylcholine infusions, phenylbutyrate IVs,
From where? Where do you find a
glutathione.
phosphatidylcholine infusion?
So this was really interesting because I was almost a guinea pig. I was
Okay.
kind of a guinea pig with hyperthermia treatment, but I was at the point where it was fetal. So they were like, this is your best chance.
Mhm.
And while it helped significantly lower my pathogenic load, it was not a silver bullet treatment. And tick-borne infections and environmental toxins take a huge hit on your mitochondria. So I
Yeah.
really needed to heal on a cellular level. And so I was doing research, and there were only a few places in the US that was doing something called the Patricia Kane protocol with phosphatidylcholine infusions and phenylbutyrate infusions. And so I reached out to them and I was like, every day I'm slowly feeling better, but I'm not myself. And I need help supporting my mitochondria. And this program resonates with me. Like, are you open to working with me? And they were like, yes, we are just starting this. Like it was a town away. I was so lucky to have this.
Wow.
Hyperthermia was a main
Where
piece
was
in
this?
lowering my pathogenic load. This was in Suffern, so like in the New York, New Jersey
Okay.
area.
Where all the
And
ticks are. Uh-huh.
yeah, yeah. So I
Mhm.
went in, and every single time I got these infusions, I started feeling a little bit more like myself. And then I finally was able to realize, like, oh, there's still me inside. Like,
Mhm.
this was not my fault. Like, I
Mhm.
had a lot of inflammation in my brain. We lowered the pathogenic load, we lowered the toxin load. We're repairing me on a mitochondria and cellular level. And then I redid my brain spec, and everything was normal. So for
Wow.
people
So you did a
listening,
respec.
I did.
Okay.
So for people listening that are just in the midst of this nightmare, and trying to navigate it, like I felt like I didn't have a lot of help navigating it, and I was so fortunate that this practice was a town away from me, because I don't think I would be where I am today if
No.
I didn't get that extra support. So all of these different things to really help you have the most sustainable health is so important. And then also having a history of tick-borne infections, being cognizant of where I'm living, making sure it's conducive to not like having a low mold exposure. There's mold everywhere, but making sure that it's not more of those toxic type of molds. And then I
Right.
still do detox, and I still try to eat healthy, things like that.
What
But
when you say detox, like what method? Like sauna, infrared sauna, like what? A
yeah,
binder? Mhm.
usually I started out because I was so sensitive, and the population that I work with is so sensitive, that before any binders, I usually try to support their drainage pathways. So their liver, their kidneys, their lymphatic system. Open up everything first in a very gentle way, stabilize their mast cells, and then also focus on gut health, because inflammation in
Mhm.
your gut can cause inflammation in your brain, which I didn't really understand, because I would eat something that had sugar and I wouldn't have to run to the bathroom. So I'd be like, oh, my gut's fine. But then I would feel depressed after it. And it's like,
Mhm.
I just ate cake. Like, why am I depressed? Cake is delicious. And then I started understanding that gut brain connection. But
And I always
so
tell people, look at guts,
yeah,
look at brain tissue, look
yeah.
brain tissue.
Yes, so
Yeah.
figure out your triggers, and just because
Yeah.
you're not running to the bathroom, like you might feel achy after this food, or you
Mhm.
might feel like anxious after this food. So I really do a deep dive in the drainage pathways, detoxing, gut support, mitochondria support, and looking into their environment. Then I bring in binders specifically on what mycotoxins they're dealing with. And then when I feel like their body is ready and strong enough, that's when I'll bring in different treatments to kill pathogens. And throughout that process, I also will do work in limbic system retraining,
Mm.
so that we're trying to get the body to
What
be
did you
more
see with your
receptive.
limbic system? Were you not, like, I see with the limbic system, a lot of people are not able to sleep. The sleep is really, really dysregulated. Not so, I don't see so much appetite, but mood, sleep, libido, like those are just gone. But did you experience any, like, because some people will get diagnosed with bipolar, of course, because
Mhm.
they haven't slept and then they become psychotic and now you're schizoaffective disorder. But what did you notice, lack of sleep or sleeping too
Yeah.
much?
Yeah, so at my worst, I couldn't sleep at all. It was, and sleep really affects people when your body needs rest to heal. And I was not able to sleep, and I was not responding to medications to help me sleep. It
Mhm.
was honestly like a nightmare, but it was my life. It was not
Yeah.
a dream. But then once I started slowly implementing these treatments in the right order and
How
not
long did it
overdoing
take?
it, um, it took it took a it took 6 months for me to be like, okay, I'm feeling
I
a
might
lot
be
more
okay.
like myself.
Okay.
But I'm not able to go back to work full time. And that's when I looked into the mole piece. I moved out of my apartment and my
Mm,
progress was a lot faster. It
okay.
also helped my sleep. But it was like it wasn't, and nothing was instant for me. It was slow and steady, and I
Mhm.
really had to listen to my body to figure out what it's going to be receptive to and what's going to be too much for it. So it
Okay.
was definitely a long process.
Okay.
But yeah, I mean, I always say fast is slow and slow is fast. So
Mhm.
if you go too fast, it could flare things up. But if
Correct.
you really listen to your body and see what it can handle and implement treatments in the right order, then that can be game changing.
Slow and steady wins the race. And
Yeah.
I watched Dr. Cornish peel the onion with that same, she went, we're gonna do mold first. There was also Epstein-Barr. She's like, we're gonna
Yeah. Oh,
do
yeah.
mold.
Everyone has that.
Yes, we're gonna do mold. Then I don't remember exactly what the pathogens were there with the vectors, and then he had the Epstein-Barr. And I'm just gonna say this. That's the first time that I've seen someone that unwell psychiatrically highlight the problem and they were like back to themselves. And the last appointment that I had with him before signing off for him to go back to work, with the exception of not being exposed to environmental toxins,
Mhm.
his wife cried. She was just like, I was so scared and I didn't know what was going to happen. And all I think about is all the people that are sitting somewhere with medications that are treating their symptoms, which, like you said, Matt, it is needed acutely. But what we've done is we've made that the answer. So I'm just going to every day treat these symptoms, and all you are doing really in that situation is putting a band-aid on a bullet wound, as I call it. But so many people, once I started seeing more and more people with Lyme, and I was able to, like, really, I'm to the point now where it's just like, okay.
Yeah.
But I wanted to go back to Chicago and test everybody on Lower Wacker Drive for Lyme. Like literally, I told that to Dr. Cordish because I was like, half the homeless population diagnosed with schizophrenia probably has Lyme. So,
100%.
not to be extreme, but the point I'm making is it's a lot of people that are misdiagnosed in our system, and it's not just those that are labeled with a primary psychotic disorder when they really have a bug in them that they caught 10 years ago. It's also people who are diagnosed with bipolar disorder because you didn't take a good history and you didn't know that somebody dropped them on their head when they were 2 and they have temporal lobe damage. Like, we have to do a much better job in psychiatry with the medical workup. Um, yeah, and covering it, because for me as a clinician, if I feel, I know strongly that this is what you have, and then you say, well, I can't afford that right now. So, that's the other big piece. A lot of these tests that are through the standard labs are not sensitive enough. And then the other companies that I know of, there's a cost. So I'm all about access. And when I started working at Amen Clinics, I worked solely in the Florida clinic for the first year, but still had licensure in Illinois and Cali. Dr. Amen is so amazing the way he structures things. It allows you in private practice, which I always had, to use SPECT imaging, and we're referred to as SPECT partners. So I'm no longer an employee of Amen Clinics, but I am a SPECT partner. And what I'm able to do is allow access, because I do accept insurance, and because you're just going for the scan, right? It's a much lower cost than if you were going there for all of the services, meaning the doctor, the intake, just all the things, right? Just think of it as if you go to an MRI suite and you go get your scan and you go back to your doctor, any imaging place. That's essentially what I do. So I'm able to work with individuals as a consultant in multiple states. I sent someone to Dallas last week for a scan, Illinois, Cali, like all over. So we are pretty accessible to most people. We have Chicago, New York, Atlanta, DC, Florida on the East Coast, and then we have Texas, Arizona, and 3 clinics in California, and we also have a clinic in Washington.
Dr. Gettings, real
Well,
quick.
we need one in Colorado.
Yes,
I'm in Colorado.
we need them everywhere.
There's a lot of mold and ticks here. So
or we could just get the insurance companies to pay for it. Y'all could just go to the hospital and get SPECT like everybody else. You
Wouldn't
know?
that be
sounds like a
nice?
good plan.
Yeah.
But real quick, so I think we always like to offer hacks on this podcast, but it sounds like you take insurance and people can come to you for your services. You take most major insurances, and then they have to pay out of pocket just for the SPECT scan, but you will evaluate that and provide guidance all under the coverage of their insurance, correct?
Correct. So I'm in network with Blue Cross Blue Shield PPO and Cigna PPO. Those are the only 2 that I'm credentialed with, but the bulk of people have Blue Cross Blue Shield PPO. Some people have HMO plans, and unfortunately, you know, I'm not able to bill for that. But when it comes to just the cost of the scan, it's definitely, if they're paying out of pocket for the scan with a SPECT partner or going through the clinic, there's a difference, just because partners are obviously in private practice, and if they're credentialed with insurance, then they'll bill for that. Because the clinic is really providing a tool for people who come that we know that they know insurance is not going to pay for, those services are not billed. And so everything at Amen Clinics is, you know, it's self-pay. They do give super bills. So after we see the scan, if there are findings that we can argue and add an ICD-10 code and say, hey, this should be covered based on, you know, criteria, then we do that. And a lot of individuals will get reimbursed to some point. So one scan, just for number's sake, if you all want to know, one concentration scan, concentration meaning prior to you getting in the scanner, you complete the Connors continuous performance test on a computer, which is a test that we use to really look at how well you can focus, your processing speed, all of those things. You walk over to the scanner, we get the scan. So it's called a concentration scan. We also can do baseline scans, meaning you're not focused on anything prior to, you just relax. Okay, but what I offer is the concentration scan. You get a lot of great info there. You get the results of the Connors. A lot of these people with Lyme, I mean, their concentration is awful. And I never had ADHD, you know, like, so you see that. And then we add in the total brain assessment, which is a computerized test about 30 minutes long that also includes measures that look at long-term memory, short-term memory. It also has the questionnaires like PHQ-9, G87 to screen for depression, anxiety, and such. And you're talking maybe 40 minutes in the clinic tops. Once all that information is collected, I sit just like I'm sitting with you, share my screen, and record. And I spend 2 hours. What I usually do, person's in network, I bill for a regular psychiatric intake appointment. So they're going to pay for the scan, but they could definitely save on cost if they happen to have Blue Cross Blue Shield PPO or Cigna PPO for sure. And one other thing to licensure. So because I'm only licensed in Illinois, Ohio, California, and Florida, anyone not living in one of those states that still wants a thorough SPECT eval with moi, I'm a consultant. It wouldn't be to establish long-term care, but that's what we do a lot in the clinic. We have people that come from all over the world, Europe, South America. I saw so many people from so many different places just sitting in Hollywood, Florida. It was mind-blowing, but they take the information and they say, hey, look, what you were doing wasn't helping, no shade, but I went over here and this is what they found to be the problem. This is what they're recommending. I do run into an issue when people have something functional like Lyme or a toxin and it needs to be worked up and they say, I can't afford it. Or where do I find a functional doctor? Right, we're focused on the integrative Lyme, the literate Lyme piece, but just in general, functional medicine is not, we're getting to it, I promise, but we're not there yet. So it's hard to find a functional doctor that'll say, well, let's give you some glutathione. Gluta what? Right. So yeah, I hope that makes sense.
We've got some ways to go. We're getting there, but it's a
We do.
process.
We do.
With mental health in general and also chronic conditions that can go hand in hand. I know we're running out of time, Matt. I didn't know if there was any other questions you had, or also Dr. Gettings, if there was anything else that you wanted to tell the audience that I missed with questioning.
I do want to just jump in real quick for Dr. Gettings because your website is drgettings.com, right? So drgettings.com. That's where people can learn more about you. We're going to drop in the show notes of this podcast a link to your website where people can learn more about working with you. We're also going to drop a link to the Amen Clinic website showing the various scans of Lyme brains because I did not know that existed. And I looked at it earlier and was blown away by the different brain scans on the Amen Clinic website. Fascinating. And, we highly encourage everybody to look at SPECT scans because it's just another piece of data to help identify what's going on. Lyme, co-infections, physical brain trauma, you name it, right? I mean, you described that so beautifully throughout this podcast. And, Dr. Gettings, I do know we have a hard out coming up. So I just want to say thank you so much for joining our Tick Bootcamp podcast. I mean, again, we've had your colleagues and we've had Dr. Plant, we've had Dr. Cornish, but we still learned so many things from you that we didn't have a chance to discuss with either of them. So I just want to thank you for bringing more to the Tick Bootcamp platform and sharing all this really helpful information with our community.
Thank you. I'm so happy to have had the opportunity to share. And what I want to leave the community with is this. Your brain is an organ just like any other organ. There's no need to be ashamed. If you were going to get your fractured toe x-rayed and you wouldn't overthink it, you should give that same amount of energy to thinking about getting a brain scan. Amen Clinics is not the only entity that uses this type of a CT scan. We are literally offering a CT scan that looks at activity instead of looking at structure. It is not that complicated. So just think about that. Any medical issue you have, usually we're going to get a picture of something. If it's your heart, we're going to look at the electrical activity. That's when they put the EKG leads. Oh, well, nothing wrong there. Let's do an echocardiogram. Let's see if your valves look okay. If everybody's looking at pictures and activity, but psych, okay? That's a big problem. And I'm here to advocate for the change of that and for the normalization of all neuropsychiatric symptoms. If a person is paralyzed, they don't have shame about that, shame about saying it. Well, I can't walk across the room because I'm paralyzed. Okay. If a person is blind, okay, just think all of those things are linked to the same organ. So why is it that if it's bipolar or an infection or disassociation, why are we now ashamed? It's another symptom and it's your body telling you something is wrong. So you better listen. And even if you don't see me, if you have a question, as y'all can see, I love to talk. So I'm just here as a resource for people who maybe want somebody to help quarterback some things for them where they are, and understanding the type of doctor they may need to see, because that all starts with the literacy. I'm Dr. Gettings on all social media platforms, just Dr. Gettings. I also have on YouTube, Dr. Gettings, my Healthy and Lit channel that I'm planning to really pour into in 2025. The goal is increasing health literacy. We gotta increase our health IQ.
Dr.
I
Gettings, we
agree,
really can't
and
thank you enough. And Michelle, I'm sorry to interrupt you, Michelle, but thank you, Michelle, for leading such an awesome discussion, Michelle. I can't thank you enough for that as well.
I am just really happy to be here. I feel like that there needs to be more awareness on this. So Dr. Gettings, I appreciate you creating that awareness. And yeah, thank you. This was great meeting with you and talking with you.
Thank you. Thank you. Likewise.